Hello guys, welcome to Med Chits. Here we have the case number 1. A 22-year-old male at the age of 13 begin to have increased in height, prognathism with enlarged hand and foot, a complete diversion from the clinical features of his twin which has a normal features. So here we have the two brother, twin child. The one is physically normal and the another one is having increase in height, then prognathism, the protrusion of the lower jaw with enlargement in the hands and the foot. Now, the laboratory findings reveals a marked elevation of the level of the growth hormone GH is elevated, and also the insulin-like growth factor 1 IGF is also elevated. The magnetic resonance imaging MRI of the brain reveals a pituitary tumor measuring length of 12 mm, breadth of 10 mm, and height of 9 mm without cavernous sinus invasion. Make a diagnosis for these patients. So here I highlighted all the clues or all the key points where you can find the disease of these patients or the abnormal pathology of the patient. In the previous video I already told that I have marked all the clues related to this case, so you can easily see here the increase in the height and enlargement of the hands and foot, then the elevation of the GH hormone and the elevation of the IGF-1, which clearly clarifies us whether it is a case of the maybe acromegaly or it can be a case of the gigantism. But here our patient is 22-year-old male, so the patient is adult. So remember A for A. For adult we have acromegaly, for children we have gigantism. So now again the case is not yet finished. We have the MRI which shows the pituitary tumor which is more than 1 centimeter, and we have it's the without the cavernous sinus invasion. So we have non-invasive tumor, right? So non-invasive tumor we called as a adenoma, and we have shown in the pituitary. So what will be our the case is about pituitary adenoma. So here I have mentioned the image. You can see this is the pituitary adenoma on MRI. Here you can easily see this one marked area, and also I have mentioned the gross appearance of the pituitary adenoma, and more specifically we can say that it is a case of somatotrophs adenoma, because here we have the involvement of the GH hormone. GH hormone is elevated. Then you can see it's in children we can say it's gigantism, and in adults we can say this it's acromegaly. So we have the symptoms of these patients of acromegaly. So from that we can clearly identify that it is somatotrophs adenoma. Thank you.